Latest news on human metapneumovirus, HMPV. Rising cases in India. India has reported a total of 7 confirmed cases of HMPV. The cases have been detected in various states across the country. The Indian government has advised states to ramp up surveillance and keep a check on respiratory illnesses. First cases in India. The first cases in India were detected in Bengaluru, involving an 8-month-old baby and a 3-month-old baby, both diagnosed with bronchopneumonia. Both infants are now recovering. Global concern. HMPV is causing concern globally, with outbreaks reported in multiple countries. The virus causes flu-like symptoms and can be severe, especially for young children, the elderly, and those with weakened immune systems. Health Ministry's response. The Indian Health Ministry has reassured the public that there is no need to panic. They emphasized that HMPV is already in circulation globally, and that the cases detected in India have no connection to international travel. Symptoms and prevention. HMPV typically causes mild to moderate flu-like symptoms, including cough, cold, sore throat, and fever. Prevention focuses on good hygiene practices, such as frequent hand washing and avoiding close contact with infected individuals. Would you like more information on any specific aspect of HMPV?